I know that Ryan really values my efficiency, but to cover all of procedures for stress, incontinence, and prolapse in 10 minutes was not really going to be something I could achieve, so we're going to focus on just colpopexy. So I'm going to divide colpopexy into 6 critical steps, and I was wondering if we could possibly put the lights down just a little bit because we're going to look at a lot of video footage. I'm going to help you take a mid-morning nap. So if it is possible to put the lights down, that would be super. The first thing is when we're dealing with a bulge in the vagina, it's catastrophic if we cause an injury to a surrounding structure. And the most common place of injury is in that first port placement. And so I always say a scar on the outside equals a scar on the inside, and we never can access the abdomen through the site of a previous scar. We use a lot of Palmer's point, as indicated by the red X in the left upper quadrant. The only patients that this is difficult in are those people who've had prior laparoscopic gastric bypass. And so I would caution people not to access Palmer's point to get in to do your colpopexy if they've had a gastric bypass.